please.
Please state your full name.
Anthony Victor Farrugia.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but
and
the
nothing
truth.
but the truth. Thank you.
Tony, we're here to talk about your dad, Barry, what happened to him and the impact it had on your family. And we're going to hear after your evidence from your twin brother, David. Your dad was one of 4 children. He had 2 brothers, Victor and David, known to you as Uncle Vicky and Uncle Dave, I think, and a sister, Angela. And your dad and his brothers all had mild haemophilia A.
That's correct, yeah.
We'll just put up a couple of photos. First of all, we've got a photo of Victor and David as young men. It's 1218016. We can see them there. Can you tell us which is which?
Yeah, my Uncle Dave, well, they both are ripped, as you can see. My Uncle Dave is the one on the left, and my Uncle Victor is the one on the right with the glasses.
And that's when they were both in the Merchant Navy.
That's right, yeah, as mild haemophiliacs, yeah.
They both lived a robust physical life.
Normal life, yeah, normal life.
And then, and we're going to come back to what happened to them towards the end of your evidence. And then we've got a picture of your dad, 1218015, please, Henry. That's your dad. Can you tell us the date and the year of that photo?
Yeah, that photo was taken on the 13th of July 1985. It was the day of Live Aid. It's my elder brother's birthday.
We'll keep that photo up for a moment, for a few minutes, whilst we talk a little about your dad, and then we're going to start looking at some of your dad's medical records, which I know are an important part of the story you want to tell. And the photo will come down then, but we'll put it back up again at the end, okay? So your dad worked for many years as a gas fitter.
That's correct, yeah. He started his apprenticeship at the age of 16 with North Thames Gas.
And he received treatment primarily at the Royal London Hospital in Whitechapel.
Correct, yeah.
But the family would go on holiday to Wales a lot.
That's correct, yeah.
And so when he was in Wales, he'd received treatment in Cardiff under the care of Professor Bloom.
That's correct, yeah. If there was a problem when he was on holiday, he always knew he could drop into Cardiff and receive treatment there.
Generally speaking, he didn't require much treatment.
No, very little.
Sometimes he'd had accidents. He, I think, fell off his motorbike or came off his motorbike once, and he didn't require any treatment for his haemophilia at all.
That's right, he broke his collarbone as well, and there was no haemophiliac treatment required.
When he did get treatment, it wasn't prophylactically, it was only in response to bleeding episodes.
Yes, that's right, yeah. If I can just say, most of the bleeding episodes with my father, there are some spontaneous there, but the majority of treatment was for work injuries. He was a gas fitter.
Now, in August 1977, the family were on holiday in Wales.
That's correct.
And your dad had a recurrence of a forearm bleed.
That's correct, yeah.
And he went to the University Hospital in Cardiff.
Yeah, he'd previously been treated, I think, just a few weeks before for that bleed by Dr. Colvin, and then while we were on holiday in Wales, he was adamant he was going to take us out in the dinghy, and I think we all got in the dinghy. I mean, we were very little children then, and we got into the dinghy, and as we were sort of going out, one of the waves hit the boat and tipped it, and he put his arm down to stop the boat going over, and yeah, reoccurrence of a small forearm bleed. So he went off to Cardiff.
Now, up to that point, the treatment he'd received under Dr. Colvin in London had been cryoprecipitate when he required it.
Yes, but he'd previously been treated with fresh frozen plasma before cryo was introduced in the mid-60s.
But no factor VIII concentrate
Nothing
until that point.
No, that's correct.
And it was that holiday in Wales when he was seen by Professor Bloom in 1977, he received factor VIII products for the very first time.
Yes.
We're going to look in a moment at some documents from August and September of 1977. But before we do so, we'll see that Professor Bloom claims in correspondence and in a telephone call to Dr. Colvin that your father developed an inhibitor in consequence of being given cryoprecipitate, and it was for that reason he was given what's referred to in the notes as high doses of factor VIII concentrate.
That's what I believe, yeah, from the notes.
But you don't think that's correct based on the records? You don't think that Professor Bloom gave him cryoprecipitate at all, is that right?
All my dad's medical records are there, as in the treatment that he received, and I approached Heath Park around about 2012 for my father's medical notes. I'd already received the London Whitechapel records. There seemed to be a document missing, so I approached Wales, at which point they told me that all my father's records were destroyed in 1989, so 8 years after his last treatment. But what they did send me was all his treatment cards of what he'd actually received. And as you can see, I mean, they're in you have copies of them. All the treatment he ever received is all been noted down. But in 1977, where Professor Bloom has said we're giving him cryoprecipitate, and he's developed an inhibitor, and we put him on factor VIII, the factor VIII is listed, but the cryo's not there.
We'll have a look at those records. Yeah. Henry, can we have, please, 1218002? So we can see these are the inpatient treatment sheets and outpatient treatment sheets, 1973 to 1981, it said, for your dad, Barry Farrugia.
Yeah.
And if we go, first of all, to page 5, please, Henry. We can see here, these are records from 1973.
Yep.
And they're recording there in 1973 cryoprecipitate.
Yep. Yeah.
If we go, please, to page 6, Henry. Again, we can see in 1974 they record cryoprecipitate.
That's correct, yeah.
If we then go to page 3, please, Henry. We then get the records for this holiday in August 1977. We can see the dates there, 11th of August 1977, and then over the following days up until the 15th of August 1977, I think the last one. And we can see that what your dad's been given there is dried 8 concentrate type haemophil.
Yeah, there's no cryo there. There's no cryo there. And the thing that I picked up on this is the medical records for the batches have been very good. And what's alarmed me is that it's been reported he's been given cryo, and everything that he was given has been listed except that cryo.
And I won't take the time showing the later records, but there are records from 1980, August 1980, again, a summer holiday in Wales,
yeah.
And then from 1981, and they are clearly recording the factor VIII products given then.
That's right, yeah.
So it's these records that are the fundamental source of your belief that your dad wasn't given cryoprecipitate in August 77.
No, it was an excuse to switch him, I believe.
Now, could we have up on screen, please, Henry?
Sorry,
yeah.
Could I just point out that at this time, my father had never been exposed to any concentrate, and Arthur Bloom knew that.
And that's the source of the statement you make in your second witness statement of your belief that your father was a pup.
Yeah, for hepatitis.
Yeah.
Yeah.
And we'll come on to he developed hepatitis around that time, and
next day.
Yeah, we'll come on to that in a moment. We'll just look at the next few documents. So could we have up on screen, please, Henry, 1218011, page 16. And if we look towards the bottom of the page, there's a typed entry for the 12th of August 1977. We can see here it says telephone call from Professor Bloom, and these are the London notes. These are Dr. Colvin's notes. This patient has now developed a factor VIII inhibitor and is in hospital in Cardiff being treated with high doses of factor VIII concentrates. So that was the notification from Professor Bloom to your dad's primary treating doctor, Dr. Colvin, of the receipt of treatment with factor VIII. Could we then have, please, the next page, Henry? We see on the same day a letter from Professor Bloom to, I think it's to Dr. Colvin. The name has been redacted, but that redaction is going to be removed. About your dad, And if we look about 6 lines down, it talks about the presence of an inhibitor. We presently have him on very large doses of haemophil in the region of 6,000 units a day. And at the bottom of the letter says, I would be very interested to know if there's been any previous hint of an inhibitor with this man. Then we see a reply at page 19, please, Henry. This is a reply from Dr. Colvin to one of the other doctors in Wales, 30th of August 1977. He says, this Professor Bloom's letter about Barry Farrugia is very disappointing news. We've really had no indication that he was developing an inhibitor, as in the past he's only had 1 or 2 treatments a year. I suppose we might have wondered when he presented on the 1st of August with a spontaneous bleed in the right forearm, but this seemed to improve with cryoprecipitate, and we thought no more about it until Professor Bloom's telephone call. So, from Dr. Colvin's perspective, no previous indication of
He
of
treated
an
him a few
inhibitor.
weeks earlier, and it was a good response, and obviously the bleed stopped. But yeah, the fall in the boat just basically triggered that again.
And then if we go to the next letter, which is the page 20, please, Henry. It's a letter the 14th of September from Dr. Colvin to the Regional Blood Transfusion Centre. You've drawn attention to this in your statements, Tony. And it says, I'm writing to inform you that one of our haemophiliac patients developed the hepatitis-associated antigen at the beginning of September. Well, I say we'll come on to the hepatitis, but we see that record there. He was formerly a mild haemophiliac who required very little treatment, and in the last year he's only had the blood products outlined in the attached sheet. These are all cryoprecipitate. Unfortunately, he's also developed an inhibitor to factor VIII, which is very disappointing. And then it talks about the cryoprecipitate being checked, but wanting to know about it. The observation you make in your statement is that whilst it's true that Dr. Colvin had only treated him with cryoprecipitate, in fact, he'd received factor VIII, as we've seen from Professor Bloom in Cardiff by this
Yeah,
time.
I honestly don't believe the cryo was administered, because it's not in the records, yet the records are so conclusively correct of everything that he received, apart from that one batch. So, to me, that's ringing alarm bells.
And then, just to complete this series of correspondence, could we have page 23, please? This is another letter of the 14th of September, this time from Dr. Colvin to Professor Bloom. And if we pick it up in the second paragraph, second line, as I mentioned in my last letter, he was formerly a mild haemophiliac. We had no real warning of the development of the inhibitor. Even more surprising is the development of HBsAg positive hepatitis when he'd only received tiny quantities of cryoprecipitate, all donors being checked by the RIA methods at Brentwood. I am checking up on this.
Yeah, I have a problem with this, because this almost seems like he's written off to the blood laboratory, stating that the hepatitis B is from cryo, yet he didn't receive cryo, he received...
We'd received cryo earlier in the year, but your
Yes.
point is
Yeah.
the hepatitis developed really
The day
quite
after.
suddenly
Yeah.
after he'd received the factor VIII for the very first
and
time.
I believe that they should have been checking the factor VIII, not the cryo.
And there are references in the records at this time to your father being jaundiced. And you've said you recall seeing him very jaundiced on several occasions, including after that first
Yeah,
administration.
he always seems to be
of
very
factor VIII.
swollen as well. Whenever he was jaundiced, he was quite swollen. He always seemed puffy. Yeah.
And we won't go to the records for this, but you've recorded in your statement, and it's in the records, that he had his first positive Australia antigen test, 2nd of September 77.
Yeah.
And it was following the sequence of events, excuse me, that we've just looked at, that your father was from then on treated with factor VIII.
Even though he had an inhibitor. It's like they've gone against their own advice. You know, Dr. Colvin writing saying, why are you giving this man factor VIII? You know, he has developed an inhibitor to factor VIII, but they carried on using it. It's just...
If we go, please, Henry, to page 13 in this exhibit. Sorry, that's the wrong reference. Don't worry. The records show that in the years that followed, your dad received commercial factor VIII products, primarily Armour, but also some others.
Yeah.
Occasionally NHS blister products.
I believe the list of products were only administered 83, 84. Yeah.
In March 81, he went on to home treatment, but not on a prophylactic basis, just to get in response to bleeds.
I wouldn't know. I don't ever recall seeing my father on giving himself treatment. I mean, we may have been taken out of the room, I don't know, but...
Your statement records that, but you've taken it from the records, and it is there in the records. And you've also noted an occasion on which he was given porcine factor 8.
Yeah, he went on a trial for 12 months. Unfortunately, Dr. Colvin went on holiday, and again, I'm taking this from the records. I was a child, I wouldn't have known any of this. So he went on to the trial of porcine, and I think he was like near enough a year in, and Dr. Colvin had gone on holiday, left a junior consultant in charge. And before they administered the porcine, they always gave him a Piriton injection, and it was working. And they forgot to administer that Piriton injection, and he just, severe reaction, and the porcine stopped.
Now, there's no evidence from your dad's notes that he was given any warnings of risks of infection from factor 8.
From the notes, no, but I will also recall a conversation with my elder brother, and it was relating to when my father told him of his illnesses, and my brother said to my father, "Weren't you warned?" And my dad turned and said, if Dad had warned me, I wouldn't have took it. You know, I do remember seeing my dad as a child with a ice pack, and what I think dysalgesics they were called then. I remember them because we were, don't touch them, they're really strong. So yeah, he would mainly, you know, he would rest, ice pack, and it was mild. It would clear up.
Now, having continued to receive factor 8 concentrates since 1977, we can see from his medical records that by May 1984, your dad was starting to become physically unwell.
Yeah.
Henry, could we have 1218-011, page 37, please? And if we look towards the bottom of the page at the entry for the 23rd of May 1984, we can see there's a record of an attendance at the haematology department, and it refers a few lines down: intermittent nausea, especially when hungry, feels bloated, appetite reduced, has lost half a stone in the last 3 months, bowels normal, no jaundice, no change in stools or urine, and then it refers to 2 weeks ago bout of vomiting and diarrhoea. That's just one example. We see a reference then at the bottom of the page to him feeling depressed. Not sure whether it's due to the nausea or vice versa. But there are a number of records throughout 1984 which show your dad reporting that he is not feeling very well.
That's correct, yeah.
If we go over the page, please, Henry, to page 38, and we pick it up on the 2nd of July 1984, halfway down the page. Feeling much the same in himself, sleeping a lot, generally feels bilious without any vomiting. And then you'll see the word results, abdominal ultrasound, liver plus spleen, so he had an enlarged spleen. And the opinion that is there set out, continuing hepatitis, and then there's a query about hepatitis B, and then it says non-A, non-B. And then we see a question mark after the reference to lymphocyte count, question mark pre-AIDS. And then we can see a reference to blood, to tests being undertaken. Now, we know from other documents that your dad's blood was tested on the 2nd, or taken on the 2nd of July 1984 for a test, where they're then HTLV3 tests. And if we have up on screen, please, 1218-004.
Can I just pick something up on that?
Yes, sorry, could we go back to that,
last,
please?
What I find quite disturbing is that I was a child. I don't know what was actually discussed in that consultation when my dad went there. I do know that at that point he was told about the non-A, non-B. But also I see there it's about the pre-AIDS keep under review, avoid alcohol, refer to Professor Jones, notify John Crask. They should have been notifying the patients first, not the doctors. He should have been told.
And just picking it up towards the bottom of that page, the entry for the 8th of August, we can see there, it talks about malaise, lethargy, weight loss for investigation of abnormal liver function tests, question chronic active hepatitis. And we'll pick that up in some subsequent correspondence. But if we then go to 12180004, please, Henry. We can see a letter dated the 9th of October 1984 from Dr. Richard Tedder to Professor Collier at the London Hospital Medical College. And it says this in the second paragraph. Well, we'll pick it up in the first paragraph. You may remember we spoke about this patient a month or so ago. I'm awfully sorry to discover that we've not sent results in writing to you. I'm afraid that I'd filed the results pending Delta testing. These will be done soon, but I do not know when. Since this man is a haemophiliac, we have tested him for HTLV3. We've also received specimens from the 8 haemophiliac surveillance group. Not surprisingly, he is HTLV3 positive. This result does not appear on the form. My apologies for causing this delay. So the blood sample taken on the 2nd of July, the positive test was reported here after a delay, which there is an apology, in October 1984. The records show, and again, we don't need to go to all of them, but the records show your dad was told in February of 1985.
That's right, yeah.
If we just pick things up in January of 1985, first of all, 1218006, please, Henry. We can see here a letter of the 31st of January 1985. It's from Professor Leonard Jones to Dr. Colvin. There's been an investigation in relation to your dad's liver disease. There's a reference to the hepatitis A IgG antibody being positive, which means he's probably had this infection at some time. There's then references to hepatitis B results, but and he says that makes persistent infection unlikely. To confuse matters further, antibodies to the CMV and EBV viruses are both weakly positive. And then he says this: I think he must have active chronic hepatitis, and the recommendation is made in relation to keeping under review the steroid treatment, which by then your father had been placed on because of the hepatitis.
Sorry, can I just point out this? I'll pick it up.
No, if there's a point you want to make now, Tony.
There's a point I want to make, and I mean it's something that was in the litigation, so it was drawn to me. It's not something that I know. It was drawn to me, but this is January '85. I don't know what was medically known then, but there is reference to that the steroids were actually they shouldn't have been given.
Because of the HIV
but they knew at that point when those steroids were given that he was HIV positive.
Yes, and so you're right. What the records don't tell us is the point in time at which Dr. Colvin was notified directly of the HTLV3 result. But it seems, if we look at 1218011, please, page 58. This is a letter dated the 25th of February 1985, so this is the following month. And we know from this letter that Dr. Colvin knows of the anti-HTLV3 positive result. And we can tell from this, I think, that your dad by this time has been told.
Yeah, he was told on the 13th of February, I believe. But again, I've only learnt that when I received the medical notes I wasn't aware of any.
No, and we'll come back to what you knew at a later stage, but you didn't know any of this at the time. But it tells us here he's developed an inhibitor to factor VIII, has chronic active hepatitis, and is now anti-HTLV3 positive with evidence of marked immunosuppression. He is obviously a prime candidate for AIDS, a fact of which he is fairly fully aware. Then there's the reference to the steroid treatment, and then to developing severe warts on the hands, which are getting worse. And then it says this: although he looks fine, I fear the long-term prognosis is not very good. but anything which brings symptomatic relief from his various problems would be worthwhile. We know from the records that your dad was started on Septin in May of 1985.
Yeah.
And then we can see if we pick things up at 1218005, please, Henry. This is April 1986, and we can see by this time that your dad is physically and mentally very unwell. This is a letter of a referral from Dr. Colvin to a consultant psychiatrist, Dr. Parks, and the significance of that will become apparent. But it says this: Mr. Farrugia has moderate haemophilia with an antibody to factor VIII, refers to hepatitis B, also anti-HDLV3 positive, and is completely familiar with what this means. He really began to feel unwell about 2 years ago when he complained of nausea and epigastric pain, and on examination it was noted that his liver and spleen were enlarged. He was depressed at the time, and then it refers to a previous depressive illness. At the consultation 2 years ago, the diagnosis was really chronic active hepatitis. For a short time, he was given steroids at the suggestion of Professor Leonard Jones. But when it became apparent that he was anti-HDLV3 positive, our enthusiasm for this approach dwindled rapidly. He's had no steroids for some time. Other medical problems have been perianal abscess, low back pain, severe warts on the hands. I have continued to see him regularly. There's been a general, slow deterioration in his condition, with enlargement of the liver and spleen, thrombocytopenia, a dry cough which responded to Septin, and now some lymphadenopathy in the right axilla. And then this: when I saw Mr. Farrugia yesterday morning, he and his wife spoke of recent black moods, uncontrollable crying, general hostility and aggressive behaviour, and he very sensibly requested a psychiatric opinion. So that's how things were by April of 1986.
Yeah.
And your dad was then seen by a psychiatrist on the 11th of April 1986. Can we have up on screen, please, 1218008? This is a letter back to Dr. Colvin from Dr. Parks, the consultant psychiatrist. It talks about him being accompanied by his wife, Cheryl. He talked openly and frankly about his feelings of anger and depression, which have been increasingly difficult to cope with recently. And then if we go over the page, please, to the second page, Henry. Paragraph in the middle of the page. In February 1985, the patient was told he had active HDLV3 virus in his blood. His immediate reaction was to feel numb. It didn't hit me for quite a while. In April 1986, however, he developed a cough and was told that the prognosis was not good. He felt that the news was broken gently to him and tried to maintain a relatively normal kind of life. From time to time, he found feelings of deep despair breaking through and found himself becoming increasingly irritable at such times. And then it talks about finding sleeping difficult and suffering vivid dreams. Now, on the 22nd of April, your dad was admitted to a psychiatric ward under the Mental Health Act.
That's right.
And if we have, please, up on the screen, Henry, 1218012, page 17. We can see at the very bottom of the page, this was an assessment carried out for the purpose of deciding whether to admit your dad under Section 2 of the Mental Health Act. And it says, I think that Mr. Farrugia is in need of psychiatric treatment, and that as he keeps leaving the ward and is too vulnerable to be allowed to do so, detention is appropriate. Section 2 application signed. So he was detained under the Mental Health Act, and he remained in hospital until early August of that year.
Yeah, they took him out to go on holiday to Wales, and I mean, from knowing more now as an adult, I think that was to say goodbye to the family. When he returned, they felt he was too well to be readmitted, but I think he was readmitted a couple of days later. I mean, yeah.
Yeah, we'll look at those because I know it's important to you that the impact of his diagnosis and illness on your dad's psychiatric health is made clear.
Yeah, definitely.
So we'll look at a couple of references in the notes, and then we'll look at the psychiatric report. So, Henry, still in 1218018012, could we have page 12? You picked up in your statement, Tony, when you read these notes, you picked up with your dad being asked questions about being sad. And
Yeah.
to you, it was obvious why he was sad, because of the diagnosis and prognosis he had.
Yeah.
But we just see here, mood, talks about your dad's comment, sometimes sad, but I can cry and this improves things. And then if we go to page 23, please, Henry, in the same exhibit. We can see in the entry halfway down the page a neurology assessment and the reference to AIDS-related encephalopathy. Now, if we could then please have up on screen, forgive me while I check the reference. Yeah, it's still in Exhibit 12, Henry, page 2, please. This is a document produced by the psychiatric team following your dad's discharge from hospital. It's dated the 10th of September 1986, and we can see the diagnosis, organic brain syndrome / psychogenic psychosis. We see the reason for referral on the first page. The patient was initially referred to Dr. Parks on the 10th of April on account of recent black moods, uncontrollable crying, general hostility and aggressive behaviour. Refers to him being seen by Dr. Parks. We've seen that on the 14th of April. And then the patient continued to deteriorate. On the 20th of April 1986, his wife became concerned about his robot-like actions, abrupt and aggressive behaviour, shouting episodes and talking to himself. And that's the point at which he was admitted under the Mental Health Act.
Yeah.
If we go to the next page, please, Henry. Under the heading History of Present Illness, it says this: the patient was probably last well 15 months ago before receiving the information he was HTLV3 positive. The patient was at first accepting and rational, but 6 months later more irritable, short-tempered and aggressive. The patient began shouting without provocation, much to the despair of his wife. It refers again to the referral to Dr. Parks, and then your patient's wife returning to find his behaviour robot-like and more aggressive. The patient was holding conversations with himself and repeating what was said to him 3 or 4 times. The patient's boss telephoned his wife on the 21st of April 1986, giving more evidence of bizarre behaviour the previous week. For example, staying at a client's house till 1:30 in the morning and insisting on fixing her porch light, which was not defective. There's a reference to sleep disturbance and nightmares. And then we can see a description of your dad's mental state on admission. And is it okay for me to read
Yeah,
these?
put it up. Yeah.
Mental state on admission talks about him refusing at first to be interviewed. The patient was still in possession of his knife after dinner, which when taken from him, he said, "That's my library book." The patient also looked menacing, pointing to one of the nurses and said, "Do you trust me? I'm not going to rape you." Talk, answers far from the point. The patient was also conversing with someone or something outside the room. Thought content, the patient refused to answer any questions about the past. Thought insertion, I'm receiving messages from Dr. Parks all the time. He puts thoughts in my head. Thought broadcast, I transmit my thoughts to Madeleine Leary. I'm doing it now, even you can hear it. No evidence of thought emission / withdrawal. Auditory hallucinations. I'm always hearing the voice of Madeleine Leary. She tells me to phone Dr. Parks. I'm also able to receive messages from Radio London. Perceptual disturbance. Convinced my blue pen was red. There was no evidence of any passivity phenomena. Paranoid ideas. Why are you cross-examining me? Mood, much calmer. Guilt, low self-esteem, suicide, no ideation. Affect, perplexed. Uncooperative at times. And so on. Insight, poor. And we see there the diagnosis, organic brain syndrome, psychogenic psychosis, and then the references to the chronic hepatitis and AIDS and haemophilia. And then finally, in relation to this report, page 5, please, Henry. Treatment and progress. Barry's mental state remained disturbed, however, gradually settled, and there's a reference to the drug he was given. There was a problem with recurrent nosebleeds and dialysis consistent with acquired immunodeficiency syndrome. His mental state continued to improve, and then it refers to during July there being an overall deterioration in his physical condition with an episode of active hepatitis and acute liver failure, but then a recovery described as remarkable and his mental state improving. And then we see the reference to going on a holiday for 10 days to Wales. And he was officially discharged in terms of the psychiatric admission.
Yeah, yeah.
But it said it's probable he'll need further assistance in terms of his physical state. So that's late August 1986. If we have up on screen then, please, Henry, page 37 of this exhibit, Exhibit 12. This is after your dad's returned home, and it's a letter from the social worker requesting a referral to a day hospital. And it just gives us some insight again into how your dad is feeling at this time. It refers to him having recently spent several months as an inpatient at the ward at the London Hospital following a nervous breakdown. And then it says this: Mr. Farrugia is now at home and feels lonely and isolated as his wife is at work during the day. Although Mr. Farrugia is by no means demented, he is rather confused at times, has a poor memory and cannot concentrate sufficiently to occupy himself during the day. This leaves him feeling anxious and frustrated as well as lonely. In early September, so not only a couple of days after that, we see your dad being seen again by the doctors and admitted back into hospital. Can we have, Henry, please, 1218-011, page 46. So we've got an entry at the top of the page, 1st of September 1986. Describes your dad as weeping on arrival. Says he doesn't know why he is sad. Rang his wife 15 times today, begged her not to go to work. No other real symptoms, and then it refers to moderate vomiting, pathologically excessive eating. A little further down it says this: looks awful. Opinion HIV-related symptoms and signs with candida, depression, incipient hepatic failure, nosebleeds. And then there's a reference to arranging for further assessments of him the following day. And we see that on the 2nd of September, psychiatrists feel that Mr. Farrugia's present problems are really medical. And if we look further down the page, the bottom entry, 5th of September 1986, admitted to the London Hospital. And that was your dad's final admission to hospital.
That's right, yeah.
We'll just look at one further entry in the records, if it's okay with you, Tony. It's in 1218-011, page 71, please, Henry. This is the notes taken by Dr. Colvin, or on Dr. Colvin's behalf, I think, on the 5th of September 1986, the day of his readmission to hospital. It refers to problems including confusion, depression, crying and dizziness, all problems worrying. It describes him as looking weary and tired and pale. Under the heading mood, it records your dad saying this: I feel sad because I'm going to die. Crying at times, thinking about dying. Bottom of the page, I feel sad because I'm dying. And then your dad died on the 22nd of September of 1986. Tony, we've been talking about your dad's story because you wanted that story to be told.
Yeah, definitely, yeah. Yeah.
I just want to ask you, if I can, about what was then happening to you during this time and then what happened to you after your dad's death.
I'd already been removed from the family home long before this. There was the relationship with my stepmum was abusive. I don't remember when it all started. I know that there's reference in my dad's medical notes in 1981 that we were seen by child psychologists because of our delinquent behaviour. Can
I take it back slightly earlier than that?
Yeah. But
before we do so, just to bear in mind, you make a number of statements about your dad's wife, your stepmother, in your statement. You know that she's provided a statement in response, which will, of course, be published on the inquiry website as a matter of fairness to all. And, you know, I'm not going to go into the detail of which of those accounts is right or wrong, or whether the position lies somewhere in between. First of all, you were one of twins.
Yeah.
So we're going to hear from David in a moment, but it's 1218-014 is a photo of the two of you. We can see there, you've got to tell me which of you is which, I'm afraid.
I think.
It's written on the back, I know, but I haven't got the back.
Yeah, I think David's on the table. I'm sure he had the tan shoes, but then I don't know.
Well, we can see you're identical twins.
Yeah,
And
we
you
were
were dressed identically.
Yeah, apart from the shoes, that was
And you're about 10 years old.
I was 10 and a half when that was taken. Yeah.
Now, your dad had split from your mother in 1973 when you were
18 months
old.
Yeah.
He remarried, as I said. We're not going to go into the rights and wrongs of any of it. But you, as a matter of fact, you grew up for a number of years thinking that your stepmother was your birth mother.
Yeah, we were so young.
Your actual birth mum, you met a few times, but she was introduced as an auntie when visiting the house.
Yeah. And that's all been explained to me since then. Why?
Whatever the ins and outs and rights and wrongs, it's a fair description to say that there were elements of your childhood that were difficult.
Very difficult, yeah.
In 1984, when you were 13, you ran away from home a number of times.
Yeah.
And in November of 1984, you ran away again. It's very cold. You didn't return home till 3 a.m.
Yeah. Oh, but it was only because it was cold.
Your dad was pretty cross when you got back. And after that, it was suggested you go and stay with your birth mother for a
I was
period of
asked,
time.
yeah, if I wanted to go and live with my mum, which by then we'd been told. My mum lived in Marsh Farm, and at that age I thought I was moving to a farm with loads of animals, so yeah, I wanted to go.
So you moved to live with your mum, but that arrangement didn't last very long.
I think the psychological trauma that I'd suffered at the hands of my stepmum, I wasn't really being fair to my mum, and I think I took it out on her, and she was brilliant, but I didn't know her. And I think at that point then I was. We were damaged. My mum got a damaged child back.
And so by the June of 1985, you were staying with a friend, and then in the summer holidays, social services turned up and
I was
took you
staying.
into care.
I was staying at a friend's house. I'd been there a few weeks, and I think we were in the process of, because his mum was happy for me to be there, and my mum was happy for me to be there, and I think we were in the process of getting the child benefit changed from my mum to my friend's mum, so that there was. And I was going to live there, and everybody was happy with that. I mean, obviously, I didn't know what was going on in the background. I didn't know my dad was ill. And I just remember coming out of the house. It was on the first day of the holidays, and where he lived, you had to come down a ramp to get to the road. And I remember coming down the ramp, and there was a car parked there, and there was 3 people in the car. There was 2 men and a woman in the back of the car. They were all suited and booted, and they got out of the car and they said, "Are you Anthony Farrugia?" I said, "Yeah." They said, "Can you come with us?" I didn't question it. I got in the car with them, and they took me into care.
And you, after that, you lived in a children's home until you were 16 years old?
No, it was just before, actually, I think. I think the date that I actually left the children's home was around about April and May of 1987.
Now, you've described in your statement your dad coming to visit you with your brothers in 1985, and then around the time of your birthday, I think, and then he came back a week or so later, and that's when he told you that he was HIV positive. Yeah,
I moved into the children's home in Luton, which is actually right across the road from my mum, my real mum. So that was quite nice that we was able to continue that relationship. I mean, that relationship was built on, and I eventually returned back to her. But I went into the children's home. Although I'd been taken in August, I was sent to like a holding home before they found me a permanent place with. It was right next to my school as well, so it made sense for me to go there. So I think I arrived at the Brambles in... it was just after we'd gone back to school, so it was the first or second week of September. And then my father came to visit me with my twin brother and his wife and my younger brother, actually on my birthday. And then the following week they came back again. I don't think I questioned it. I questioned it now as an adult and what I know, but then I didn't. And I mean, this was at the time, so AIDS was just starting to come into my eyesight at that point through television. Rock Hudson had died on the 5th of October. It was heavily all over the news, the gay plague. Still no link, I was a child. And then my dad came back and told me he had HIV.
And you say this, I was on my own in a children's home at the time and I had no support available to me. And you were distraught at this information.
Well, I think with what we'd seen on the news, I mean, I know from speaking to other people when I joined the campaign that there were snippets coming out earlier, but why would I have, to me it was nothing. And then with the Rock Hudson in the 1985 and then the diagnosis for my dad, I think at that point when he told me, I knew he was going to die.
And you've said in your statement that in hindsight, you can see that it was when he began to get ill in 1984 that
the situation in the family home got really bad in July 84, and it was only when I got the medical notes in 2012 that I was able to piece that together, and I think that was the key. And
you've got a memory of sitting in a hospital garden eating an ice cream with your dad.
That's right, yeah. So when Dad was sectioned, 14th of April, I think, the home arranged for me to go and visit. They had their own minibus, so they loaded all the children into the minibus. All of us, we all got in the minibus, 2 members of staff. They drove down to London Whitechapel and dropped me and my key worker off, and the children went to the local park. And I visited my dad, and the children went off, and they came back and picked us up later. But yes, we went across the road for something to eat, and I mean, Dad wasn't eating. He was awfully skinny, really, really skinny. And for a 6'2" man, that was quite shocking to see. So he didn't eat, but we got, I don't know whether they were Mr. Whippy or whether it was a scoop, but we got ice cream and went back across to the hospital garden. And my dad asked me for a bit of ice cream. I handed it, and the nurse stopped me and said, "You can't share that with him." He had loads of. I think at that point he had candida, and he had loads of ulcers in his mouth, which could have been bleeding. So I understand, but it's quite difficult at that age to be told you can't share an ice cream with your dad.
I think I'm right in saying that was the last time you saw your dad?
I never saw him again, no.
You were due to see him in the September, but by that time he...
Yeah, we got the home got a phone call around about the 18th of September, and I mean, it ties in now with the medical notes that he was transferred to isolation 3 days before he died. So the call came to the home to get me down there, and they sat me down and said, "Look, your dad's in isolation, you need to gown up, you need to wear a mask." I never had a problem with that. We arranged for me to go on the Monday after school. I went to school in the morning, came home. I came home from school. The key worker said to me, "Oh, we're just waiting for social services, and then we'll take you." And they didn't take me. They took me down to a room and told them.
And they told you your dad had died?
Yeah, that morning.
After your dad's death, and again, we're not going to go into the rights or wrongs of it, but the family essentially was split up, and your brother David, and he'll tell us more about it in a moment, but He was also placed into care, but the two of you were not in care together. You were separate. You stayed where you were. He was placed in care locally.
Yeah, we
for
was
his
roughly
school.
about 80 or 90 miles apart. I was Bedfordshire. David stayed in the area where we lived.
And one of the things you're very critical of is the lack of support from social services.
Oh, we just
at
didn't
that time.
exist after he died, or even before he died. There was no. I mean, I was in a children's home, and they were lovely. You know, that's a real highlight of my childhood. That that was a godsend. It really was. It was a great place. They were very supportive, but there was no. They weren't geared up for this. So no, I could talk to them, but again, I didn't know what I know now. So as a child, yeah, it's devastating. You've lost your dad. You don't understand, but you have to get on. And as I say, at that point, the whole family imploded. The home was gone.
All your childhood possessions,
Everything.
you don't have any of them.
Nothing. No.
Over the years, you built a life for yourself.
Yeah.
Work, marriage, kids.
Yeah.
But it's clear from your statement that what happened to your dad and the ramifications for the family has continued to dominate your life.
Yeah, but because of I learned about my uncle Vicky. I was told 3 weeks after my father died that he was positive as well. So, and then subsequent years later, Uncle Dave. So yeah, it was. It's destroyed the whole arm of that family completely.
You talk in your statement about having to listen while people would make AIDS jokes and having to laugh because you hadn't told people about.
I knew some
family
really good
history.
jokes. You had to join in. You had to. You didn't want to alert people to, oh, why is he upset because we're telling AIDS jokes. So yeah, as much as I feel bad about it, yeah, I told loads of jokes. It was sort of a way of coping, of shutting it out.
In 2008, your aunt prompted you to have a look at the Tainted Blood website.
That's right, yeah. I think it was on the back of, Archer was due to be published in 2009, and I think there'd been a bit of activity in the press, and that's where we learned of Tainted Blood, the group.
And that's what prompted you to request your father's medical records?
Not right away. No, I sat for about 2 years just watching this site, watching people's conversations, reading the timelines, trying to take it all in of what had happened. So it was 2010 that I applied for his medical notes from London Whitechapel.
And it was reading those that taught you what your father had gone through?
Yeah, I mean, I knew about the HIV, but it was at that point then I'd learned he was hepatitis C as well. We had no idea. I didn't even know all these people existed.
And you've said in your statement that reading through your father's medical records, becoming aware of the truth of what really happened to him, made you ill.
Oh, yeah, I mean, I read the notes backwards, believe it or not. When I got the notes, the first day I turned to was the 22nd of September, 1986, and read them backwards. So it took a while for me to learn what had gone on because I was reading them backwards. And I think around about 2012, maybe it was later than that. It was 2014. So we were then. I was campaigning. Not campaigning, but I was trying to help raise some funds for Factor 9 through Bruce. So I was just trying to. My family were donating, and we were just going nuts trying to raise this money to get this show. And obviously I was reading these notes as well, and I was learning about what had gone on, and I developed a pain in my stomach. And I went to the doctors, and that was quite. She was totally honest with me, and she was a lovely doctor. Actually, she's the only doctor I've ever trusted. Unfortunately, she's left the practice now, and I haven't sought medical help for a long time. But she sort of listed one of four of these are the four things it could be. I mean, I was in terrible pain, and it was on her telling me some of these of what it could be. I mean, cancer was. I'm a smoker, so bowel cancer was mentioned, and at that point, I was reliving those notes of watching my dad deteriorate and how we suffered as children, and that was relaying in how if I died, my children, because they were 4 and 5. So yeah, I got really unwell. I had several medical procedures at that time because just everything was going wrong. I'd lost about 5 stone. I developed psoriasis. I developed this rash that we just didn't know what it was. We know now. So I endured. I was coughing up blood. I was really worried, and reading those notes just put everything into perspective that I don't want my children to go through that. So I was diagnosed with IBS. So basically everything else was ruled out. I had to have a colonoscopy and not at the same time. Yeah, I did actually say that to the doctor, that you make sure you clean it before you put it in my mouth. And I said to him, please don't smile, otherwise we'll be having words in the car park. I didn't want him to be enjoying it. I was just trying to be jokey. They found nothing. They ruled out everything, so they diagnosed me with IBS. But unfortunately, I'd been coughing up blood, so I had to have chest X-rays. And as a smoker, that was bloody worrying. And actually, I was a complete arsehole with the hospital because I just would not wait for the results. And I was ringing them I want them fucking results. I want them now, because I was so and it was on the chest X-ray being clear. I'd just nicked. I had an injury in the throat, and that was where the blood was coming from. They also diagnosed me with chronic urticaria. So basically, I was just getting covered in hives every time I visited this. And just to say, Sir Brian, that when you announced this inquiry, the urticaria's gone. Still got the IBS, and I've still got the psoriasis, but yeah, it was all, and the doctor actually pulled me into the office, and by then my doctor had left and gone to another practice, and I was seeing a locum, and she actually sat me down, and she was actually quite horrible, but in a nice way. She said, we've done so much investigative work, there's nothing wrong with you. And I think it was at that point then that I still got the IBS, I've still got the psoriasis, the urticaria was still there at the point. I mean, that was chronic, it was awful. But I knew I wasn't dying, so I think that made me stronger, and I was then able to come back to, because I did step away for a while. And I think it was at that point then, I just remember it was a few weeks into this feeling awful. I actually rang up Sue Freakle, breaking down on the phone, and she rang the Hepatitis C Trust, or it may have been Caxton, and she actually she got me the counselling, which actually didn't help, because it's very difficult when you're talking to someone that ain't got a clue what I'm bloody going on about, because they don't know. And I actually felt that although it didn't help with what I'd been through, it just made me more determined to keep going, to keep fighting and to stick with it. Because at that point I pulled away, I couldn't cope with it anymore.
You said in your statement, it's worse for me now than it was when I was a child because I understand more now. Mm. At the moment, I'm not sure if this has ruined my life or defined it. Only
That's
time
right,
will
yeah.
tell.
How much longer is it? I've spent more of my life, although I wasn't aware of what was going on as a child, it was what happened to me as a child, and subsequently all the years. And yeah, we were quiet, we wasn't active, but it was still there, and other family members were dying. I've actually spent more of my life, I'm nearly 50, You know, this has been going on since I was probably 6 years old. I would like to hope that we could conclude this, and that I will spend. I'm nearly 50. You know, I'm not going to live till I'm 100. You know, I would hope that the 40 odd years that I have lived under this, and I probably won't live another 42 years, but it would be nice to know that I would live more of my life free of, and yeah, that's difficult for me. You know, I've lived so far nearly all my life under this, and I would hope that we could come to that this would end soon, and that I could have the rest of my life normal. Although it will never be normal. It will never be normal. You know, we've got constant reminders every day. You know, we've got 4,763 dads. Every haemophiliac is a reminder. It's the same for all the children.
You're part of a group, Fatherless Generation.
That's right. Yeah. I think we might change the name of that as well.
To what?
To the fatherless generations. We believed it was just a generation of children, but we're still adding them now. We still got children being added to the group. People are still dying. We added a 16-year-old only a few weeks ago, lost her dad, and yeah, it's shocking. You know, our group's just going to grow.
You observe in your statement, Tony, that other than the support or the counselling you've just identified, which was actually organised with the assistance of Sue Thrackle.
Yeah.
You were never.
Do you know what? That's really funny, actually, because I was hearing Sue the other day, and I felt so bad because when she went to get it, it was gone. We'd used all the money up. I felt really guilty because she'd done that for me, and I know many others. And then when she came to her time, the money was gone.
The point you make in your statement is that at the time you were going through all this, during your childhood and young adulthood, you were never offered any counselling or support, even though social services were heavily involved in your life.
Yeah, there was nothing. There was absolutely nothing, and that's not taking anything away from where I was in that children's home. They were lovely, you know, but they weren't qualified to deal with it, and it was emerging as well. You know, it was emerging, and yeah, not a lot was known, as in there was no support.
Just wanted to ask you about your experiences in relation to the financial support schemes and trusts, and again, without going into any questions relating to family disagreements about those matters. Your experience has been that as the child of someone whose father was infected and who died, there is and was very little by way of financial support.
I'll actually correct you on that. There's nothing. Yeah, there's nothing. Very little doesn't even come into it. The children are completely. I mean, bearing in mind, my father died before the trusts were even set up, and they've never recognised that before these trusts were set up, people were dying, and I know that there is support through the victim that victim is allowed if the children are under the age of dependency, that there is an amount of money that is paid for your children, but unfortunately, by the time the trust was set up, I was an adult, so yeah, we pretty much went through those last of our 4 years of our teens. There was no support, there was nothing, and it's never been recognised either.
And if we just have up on screen, please, 12188013. Page 10. And again, this is not about whether things should have been done differently at a family level.
Yeah.
But this is about what was done by the McFarlane Special Payments Trust.
Sorry, can I just ask you where you got this? Because I'd lost it.
You gave it to us.
Did I?
Yes.
Oh, that's probably why I lost it. I thought I'd lost that.
It's very kindly exhibited to your second statement, Tony.
Ah, right.
And you'll see there it's a letter dated the 10th of May 1990 from the McFarlane Special Payments Trust, addressed to you.
Yeah.
And it talks about the making of an ex gratia payment of £20,000 to your father. And then there was a discretion given to the trustees of the trust as to how the money should be allocated.
Yeah, it was.
And we can see from this they decided that the main beneficiary should be your father's widow, and that you and your brothers would get £1,000 each.
Yeah, that's correct. Yeah.
And then there is some, again, your statement and your brother's statement deals with the amounts. There's some amounts of a similar magnitude referred to later.
Well, this was the special category mechanism payment that was set up and run by the Haemophilia Society. So, 1988, I think it was set up, and the government put, I believe, £10 million into like an emergency fund. All these people are dying. We better. So it was £20,000, and I believe that this was just for HIV victims at the time. Yeah.
And again, I'm not going to ask you about the detail of the sums involved, but the point you've made as a point of principle in your statements is you think that the children of those who were infected, your fatherless generation, were overlooked and forgotten and let down by the trusts.
Yes, definitely, yeah.
Can I then ask you just a little about your uncles? And I'd like to have back on screen, please, the photo. I think it's 015. Oh, sorry, we'll put that one back in a minute. The picture of your dad, it must be 016 then, please. There we are, the picture of your uncles, and I know David's going to say a little about them as well, and we've got the statements from their family members.
My knowledge on who they actually were is obviously I was a child growing up with these people. So this picture was Merchant Navy. I think they left the Merchant Navy. My Uncle Dave went to London Underground, and my Uncle Vicky stayed within the dock system. I don't know where the docks would have been, Canning Town. Canning Town. Vicky stayed with the docks, and I don't remember the dates, but there was a severe accident with Vicky. And again, I don't know the full details of it. It was before I was born, but I believe it was sometime in the 60s, 66. I don't know whether there was a storm. They were in port, whether it was a storm, rough, the boat was rocking, I don't know. But one of the metal doors of the ship flew open, and that was the hatch. And basically, on it, his head was in a real mess, mild haemophiliac. And again, my knowledge is patchy. And I'll keep looking over there for. So as far as I know, he was packed in ice. He was packed in ice. He was in hospital for many months. I've also been told that there were medical reports in magazines all over the world about this haemophiliac that had survived this horrific head injury. He was a mild haemophiliac. Yeah, he survived it. He had to learn to read, write, walk, talk, because all that function had been wiped out. But he learned, and he survived that, only to be.
And he was infected with HIV and hepatitis C.
That's right. Yeah. My Uncle Dave, he left the Merchant Navy, and he became foreman of London Underground at St James's place, or whatever it's called. They were both. They all were, they were good people. They had, we all had families, and it's been destroyed. But I know my Uncle Dave suffered. I know he was scared. He was scared. He'd watched his younger brother die. He'd watched his older brother die, both from AIDS. I know that from speaking to him, it was very close to him. It did affect him, and actually he told me a story of when he went for testing. I don't know when it was, but he said to me that he'd already planned his day. He'd already seen my dad die. He knew that Vicky was infected. He went for testing, and he said to me, if I would have been diagnosed HIV, he said I would have just come out of the hospital and jumped in the Thames. He said, because I just watched my brother die, and he said I weren't going to go through that.
David was diagnosed with hepatitis C.
24th of December, Christmas Eve.
And your aunt's statement says that none of her 3 brothers would have taken the treatment if they'd been warned of any risk of possible infections.
Yeah, that's right.
They'd led almost normal lives as haemophiliacs.
They were mild. They would have rested. They would have iced. They would have taken painkillers and.
And Victor died in August 2002. David died in April of 2012.
That's correct.
So all
yeah.
3 brothers
So for
gone.
us, it's been, and it's still ongoing. You know, we've got other family members infected. We've been burying our dead for 33, 34 years. Yeah, it's been, and again, as I was referring to the 4,763 dads which the children have got. You know, this is a constant reminder of what happened to my dad again and again and again, and then with all these people again and again and again. It's just an assault.
Those are my questions, Tony. I'm going to ask Mr. Snowden if he's got anything further. Henry, could we have up on screen, please, Exhibit 12, page 5? Just one matter that Mr. Snowden asks me to raise, Tony. This is back in the psychiatric report that we looked at. And the point which Mr. Snowden asks me to note with you is under the heading of prognosis, where it refers to the probability that your dad will have further problems. It says this too: his wife and family will also be in need of much support, counselling.
That never happened.
But the need for that was identified before your dad died.
Yeah, it never happened. We've been, I don't know, we're the can that's been kicked down the road, haven't we? And yeah, there's been no support. Nothing.
Tony,
Matter of fact, I think they wanted us to just to disappear.
I know there's something more you want to say, and that I think Sean's going to say on your behalf as well.
Yeah.
But we'll just put the picture of your dad back for that purpose. Thank you very much, Henry.
So, I'd like to start with something that I was sent by one of the children. I'm not gonna name them, but yeah, they've lost family as well. I can't read this, so Sean's going to read it.
There's a darkness in my heart that I cannot lay to rest. Tainted blood on the conscience of the NHS. To you they were numbers, secrets locked away. But for the families who watch them suffer each and every day, the trauma still lives on. How can they be at peace when you dare not speak their names for the fear it may release? You feel you do not have the time nor the crayons to explain. But we're here to tell the world we will not let them die in vain. My dad was strong in mind and heart, but it was battle he could not win. He bravely fought and suffered the hep C that you gave him. We have seen this pain before, as you gave my uncle just the same, along with numerous HIV, of whom we dare not speak their names. Hushed if we try to talk, or denotice you'll serve. So we're invisible without a voice, and our stories can't be heard. But as silent as the sunrise, we will stand together and shine. For our silent voices will be seen with our picket boards and signs. I hope our spirit and our courage will mirror their bravery and strength. We will fight for their justice regardless of our journey's length. The lives were taken so tragically. Please show us that you care, so we can somehow move forward without this sorrow and despair. Give us justice, give them dignity, and give us the answers we deserve. Let them know that we have seen this through and that our voices have been heard.
Right, I'd like to say something, and I'd like you all to bear with me. Before this inquiry was announced, some of you may have known me as the man who paints his face red at protests, or going red as I call it. I couldn't have done the investigative stuff. It was just too much for me that others have done. But I was told that going red helped us get press for the campaign. Through doing the campaign stuff, many of you have become very, very good friends. Also those who have lost their fathers to factor products. I'd like to take a little moment to talk about our group, the fatherless generation. Before 2017, only a handful of us knew each other, but after the Panorama programme that year, more and more of us connected, realising that we were not alone. There are now over 120 of us, and that number's still growing, who all know the lifelong pain of losing a parent to this scandal. We know what it's like to have to lie about how your parent died, what it's like to hear age jokes, what it's like to feel that you cannot tell anybody what happened because they'll think you're a lunatic. The children of dead haemophiliacs have been treated appallingly. We have always been excluded from ongoing support. Even now, we get nothing. We probably avoided making a scene or a fuss over this because we didn't want the government to take away from the infected. We see how the government have saved money excluding the children. The government created arguments, watching the infected widows and watching the infected and widows fight over scraps about who deserved what. While all this happened, we sat silently, scared to suggest that we should be recognised. The dying fears of our fathers were confirmed. Many in our group have psychological trauma that has ruined their education, left them unable to work, or at best, they've never reached their full potential. We have all lost far more than just our parents. Some in our group never knew a life before the contaminated blood scandal. They were born into it, and it is all they've ever known. For them, their lives were not just turned upside down one day. They were damaged from the beginning. The government has never taken into account the family turmoil that happened, how our families were torn apart. People broke up and got divorced. When the government say they are supporting affected people, what this really means is they are supporting the widows. It's as if we don't exist. If your parents divorced before your dad died, then there is no widow, and the government saved money because you're excluded entirely. The government always talks about infected and affected, but when they tweak the schemes, we're affected. Some of us our entire lives, but no matter what tweaks they make, we never get anything. It's the same for the parents who lost children as well. But we must always remember that the worst affected by this scandal are dead. Schemes will not help the dead. Schemes have been used to play the haemophilia community against each other. And no scheme will ever give these people independence. We want the government to set up a full compensation panel like in Ireland. It is often said by victims and their families that the government will wait until everybody's dead before paying compensation so that it will be cheaper. In the Republic of Ireland, the compensation panel was set up in such a way in the Republic of Ireland, the compensation panel was set up in a way that the compensation provided to a bereaved family was paid to the infected person as if they were still alive. The full claim did not die with that infected person. This was because if this was not the case, then the government would have saved money by waiting for so many people to die before doing something. We don't know yet if compensation will ever be paid, but if it is, this must be something that happens here too. It might be exceptional in law, but I think we can all agree that this is an exceptional event in the very worst of ways. I also want to talk about the pharmaceutical companies, as well as BPL. Some of the pharmaceutical companies that sent infected factor products here are Bayer, Baxter and Revlon Healthcare. Unfortunately, in this country, the press are too scared to mention the names of pharma for fear that they will get sued. We can't name the killers of our parents, or people are told just not to mention the pharmaceutical companies' names in interviews, and if they do, the press just cut it out. At the opening hearings last September, the inquiry said it had asked 5 pharmaceutical companies for documents, but they did not name those companies. The government also never names those companies, such as Bayer, Baxter, Revlon Healthcare, when they speak about this. The silence on this must end, and we must, once and for all, be able to name our parents' killers. On top of the confused press reports that often show bags of blood instead of factor products, this is part of the reason why what's happened to the haemophilia community is so poorly understood by the general public. Revlon now distanced itself from the scandal because it sold off Revlon Healthcare in the mid-80s after people began to be told about HIV. Revlon wasn't always just a cosmetics company. Revlon Healthcare company Armour supplied factor products to this country which killed people with hepatitis and AIDS. It's now time for those companies at least to acknowledge what happened. They need to stop hiding us from their history. As guilty as the Department of Health is, at least they accept this happened. The same cannot be said for companies like Revlon. They cannot get away with this anymore. And before I say the next bit, I would like to thank Des and Danny at Collins Solicitors and all of the people that work for Collins. You've been amazing. You really have, and we can't thank you enough for believing in us. But I also want to thank our counsel, Brian Cummins and Stephen Snowden. I want to thank them for their inquiry work, but also for the group legal action which was placed at the court 1 week before this inquiry was announced. There is something in one of the group legal action hearings last year that people might not know about, and I want to say something about that today. A lot of people here, including myself, have a very low opinion of Kenneth Clarke from when he was Health Minister, and we want him to give oral evidence. Part of this is that in 1983, Kenneth Clarke said there was no conclusive evidence that AIDS is transmitted by blood products. Obviously, this was not true. The term conclusive evidence was used by the government a lot in the 1980s about AIDS. Last year, at one of the legal action hearings, Justice Martin Spencer said that the use of the words like conclusive evidence is somewhat disingenuous if they had information on the balance of probability that there was such a link. I think Kenneth Clarke needs to give us answers. And just for the record, there's no way this man should ever be Prime Minister. He should be in prison. We're all obviously pleased that this inquiry is happening, but there's an unfairness that puts us all at a disadvantage. Pharmaceutical companies have billions of dollars. The government have open access to taxpayer money and the health services. But we have to apply for everything. We are not allowed legal funding for the investigation into this inquiry, and this seems very unfair. And we know that victims in the Grenfell inquiry have had the same problem. I think this needs to change so that we can independently review the inquiry reports, because those who do have the money and the power will. We are not on an equal footing with government, health services or pharmaceuticals in this inquiry. We need to remember that the government and civil service never wanted this inquiry. In November 2016, Nicola Blackwood, who was the Health Minister, said in the House of Commons, the Prime Minister has been very clear that we do not believe a public inquiry would provide further information. I think we can all agree that from the hearings so far, she was not correct. But we are used to ministers who deny us justice. In 1999, Baroness Hayman said a public inquiry was not the way forward. In 2000, John Denham said, "All the information is in the public domain, and I do not believe that anyone's interest would be served by a public inquiry." In 2001, Lord Hunt of King's Heath said, "There would be nothing to be gained from a public inquiry." In 2002, Lord Filkins said, "I do not believe that there is benefit to anyone from a public inquiry." In 2003, Lord Warner said, "The government do not accept that any wrongful practices were employed, and we do not consider that a public inquiry is justified." In 2004, Lord Warner also said, "Wrongful practices have not been employed. We do not believe that this public inquiry is justified." In 2006, Caroline Flint said, "We do not consider a public inquiry is justified." Sorry, bear with me.
Don't worry.
Sorry about this, just bear with me. Just bear with me a minute. I seem to be missing. Thank you. Excuse me for this. In 2006, Caroline Flint said, "We do not consider a public inquiry is justified." In 2008, Lord Darcy of Denham said, "The government do not accept that any wrongful practices were employed, and therefore a public inquiry is not justified." In 2012, Anna Soubry said, "After all this time, there is no justification for a public inquiry." In 2016, Jane Ellison said, "Another inquiry would not be in the best interests of the sufferers and their families, as it would be costly." All these ministers denied us the truth. They were all wrong. Thank you.
Can I say I don't think there is a single person in working in this inquiry, this includes me, who does not think that the inquiry is fully justified, whatever the result may be. Secondly, can I say and assure you that so far as the investigation is concerned, we have all the money and resources that we need. That has been promised to me by Parliament. It was promised under the last if you call it the last administration, the last Prime Minister, and it's been promised under the current Prime Minister. And I take government at its word on that, and I'm busy spending that money in pursuit of what may be the truth. And I won't spare the pennies on that, even though I have an obligation to safeguard the public purse generally. Can I turn from that to you and your evidence? Because it is, I think, particularly difficult to talk about the loss of a childhood, the loss of a whole arm of the family, as you put it, only to be followed by the consequences of your father's death, because the increasing knowledge of what may have happened to him has brought its own problems. And you spoke about wishing to be normal. It's a matter for reflection that in your search for normality, you are here giving evidence in what is not a normal position for anyone to be. And I think you deserve a tribute for that. Thank you.
So, Brian, I'd just like to thank yourself, and I'd like to thank Jenny especially, and I'd like to thank the rest of the inquiry team. Thank you. Thank you. Thank you very much.
We'll take a break now for 20 minutes. Depending on how long David takes, there's no, we will go on till we finish, and you must not feel under any pressure. But depending on how long that takes, we may take a late lunch today. So I'm telling people now, in case it alters their eating habits in the next 20 minutes.